Have you ever wondered why your Adam's apple seems too big or a bit out of place? Have you ever wondered why it doesn't seem to fit your face? You might see it as huge round-like bags sticking out on your neck. Well, that might be goiter. And we're going to talk about it if it's safe or you should be concerned about that.
What is the thyroid gland? The thyroid gland is a butterfly-shaped endocrine gland that is normally located in the lower front of the neck. The thyroid's job is to make thyroid hormones, which are secreted into the blood and then carried to every tissue in the body. The primary activity of the thyroid gland is to concentrate iodine from the blood to make thyroid hormone. The gland cannot make enough thyroid hormone if it does not have enough iodine. Thyroid hormones help the body use energy, stay warm, and keep the brain, heart, muscles, and other organs working as they should.
Goiter is an enlargement of the thyroid gland in the neck. That's the gland at the front of your neck just below your Adam's apple. A goiter can be caused by a variety of factors and conditions. A goiter can occur in a gland that is producing too much hormone, hyperthyroidism, or too little hormone, hypothyroidism, or the correct amount of hormones, euthyroidism. It may be a temporary problem that will get better without treatment, or it can be a symptom of another, possibly serious thyroid condition that requires medical attention. Having a goiter doesn't always mean that your thyroid gland is malfunctioning. Even when your thyroid gland is enlarged, it can still produce a normal amount of hormones.
Signs and symptoms. The signs and symptoms of goiter are noticeable swelling in the neck, difficulty swallowing or breathing, coughing, hoarseness in your voice, and dizziness when you raise your arm above your head. Other signs or symptoms depend on whether thyroid function changes, how quickly the goiter grows, and whether it obstructs breathing. The symptoms of underactive thyroid or hypothyroidism are fatigue, increased sensitivity to cold, increased sleepiness, dry skin, constipation, muscle weakness, and problems with memory or concentration. In overactive thyroid or hyperthyroidism, the symptoms are weight loss, rapid heartbeat or tachycardia, increased sensitivity to heat, excess sweating, tremors, irritability and nervousness, muscle weakness, frequent bowel movements, changes in menstrual patterns, sleep difficulty, high blood pressure, and increased appetite. In obstructive goiter, the symptoms are difficulty swallowing, difficulty breathing with exertion, cough, hoarseness, and snoring.
Causes of the disease. Iodine deficiency is the main cause of goiters. Iodine is essential to helping your thyroid produce thyroid hormones. When you don't have enough iodine, the thyroid works extra hard to make thyroid hormone, causing the gland to grow larger. Other causes include the following. Graves' disease occurs when your thyroid produces more thyroid hormone than normal, which is known as hyperthyroidism. The excessive production of hormones makes the thyroid increase in size. Hashimoto's thyroiditis predisposes thyroid to not being able to produce enough thyroid hormone, causing hypothyroidism. The low thyroid hormone causes the pituitary gland to make more thyroid-stimulating hormone, which causes the thyroid to enlarge. Inflammation. Some people develop thyroiditis, an inflammation of the thyroid that can cause a goiter. This is different than Hashimoto's thyroiditis. One example is viral thyroiditis. Nodules. A nodule is the irregular growth of thyroid cells that form a lump. Solid or fluid-containing cyst may appear in the thyroid and cause it to swell. These nodules are often non-cancerous. Thyroid cancer. Cancer may affect the thyroid, which causes swelling on one side of the gland. Thyroid cancer isn't as common as the formation of benign nodules. Pregnancy. A hormone produced during pregnancy, human chorionic gonadotropin, may cause the thyroid gland to be overactive and enlarged slightly.
There are numerous causes of goiters. As a result, there are various types. This includes colloid goiter, which is also known as endemic, a colloid goiter develops due to iodine deficiency superimposed on other goiterogenic factors normally present, responsible for sporadic goiter. People who experience this type of goiter tend to live in areas where iodine is scarce. Second one is non-toxic goiter, also known as sporadic. This is defined as a benign enlargement of the thyroid gland in a euthyroid person who lives in an iodine-sufficient area. The cause of a non-toxic goiter is usually unknown. This medication such as lithium may be to blame. Third one is toxic nodular or multinodular goiter. This type of goiter involves an enlarged thyroid gland containing a small rounded mass or masses known as nodules that produce too much thyroid hormone, resulting in hyperthyroidism. It usually appears as an extension of simple goiter.
The treatments for goiter are the following. No treatment or watchful waiting. If the goiter is small and is not bothering you, your doctor may decide that it doesn't need to be treated. However, the goiter will be closely watched for any changes. Second are medications. If you have hypothyroidism or hyperthyroidism, medications to treat these conditions may be enough to shrink the goiter. Medications to reduce your inflammation may be used if you have thyroiditis. For managing pain, if the inflammation of the thyroid results in pain, it's usually treated with aspirin, naproxen sodium, ibuprofen, or related pain relievers. Severe pain may be treated with a steroid. The third options are surgeries. Surgical removal of your thyroid, known as thyroidectomy, is an option if yours grows too large or doesn't respond to medication therapy. You may need to take thyroid hormone replacement depending on the amount of thyroid removed. Radioactive iodine. In people with toxic multinodular goiters, radioactive iodine, or RAI, may be necessary. The RAI is injected orally and then travels to your thyroid, to your blood, where it destroys the overactive thyroid tissue. Home care. Depending on your type of goiter, you may need to increase or decrease your iodine intake at home. If a goiter is too small and doesn't cause any problems, you may require no treatment at all. As with surgery, you may need to take these thyroid hormone replacement to maintain the appropriate levels of hormones.
Thanks for watching. I hope you learned something.